So if I were to be talking to a patient about what 5 metrics to track in the new year, maybe to improve their health or for the betterment of themselves, I would want to focus on non-medicine stuff. I think we should talk about joy and quality of sleep, quality of diet, exercise endurance, and mood. And then thereafter, we can, of course, consider all of the things that come with numbers, like blood pressure and weight and body mass index, labs, and all those things. And it's not that they're not important, but I think it's much more approachable if we think about dynamic things that we can do in the background at home daily to improve our health. If we're thinking about the joy metric, I think that looks different to each person. And I just try to think about what is it that you're doing for yourself every day in a little or big way that makes you smile or warms your heart. So for some of us, that might look like exercising every day or reading for a few minutes. And for others of us, it shows up differently. It's important to identify what it is for you. And then I think tracking it to make sure that you are, in fact, practicing self-care and not just giving always to others. A lot of times when people come into the office and we talk about sleep, we talk about it in really vague terms. And one of the things I like to drill down a little bit more is this concept of sleep hygiene. And sleep hygiene is what you can do to better prepare yourself to have a great night's sleep, and what environmental factors you can control, because of course we can't control everything. So we talk about having blackout curtains to make your room dark. There's evidence that fans and white noise can improve quality of sleep. We talk about putting screens down, which is almost impossible, at least an hour before bedtime. And we talk about emptying your bladder before bedtime, making sure the room is quiet and nice and cool. I think another thing that's important is assessing the quality of our diet. At all of my physical exam and new patient visits, one of the things I talk about is, do you think you're eating a generally good diet? And lots of times people say yes. And then I ask the harder questions. Do you think you're getting 5 fruits and vegetables a day? Are you getting 30 grams of fiber a day? How much protein are you getting, and what is the source? And I think when we ask some of those more nuanced questions, we can sometimes optimize what seems to be already going kind of well to make it really excellent. And if it's a question that's too hard for me to answer or that I don't have the skill set for, we have some good health coaches on board with us that can partner to help with dietary and nutritional counseling. Another thing that can be really helpful as we're setting goals for the new year is tracking the metric of your exercise endurance. And that probably can look different to lots of people. For some of us, that's figuring out that riding a bike for 10 minutes gets easier the more we do it. For others of us, that looks like lifting heavier or hitting a PR at a running race. And so I think figuring out what that metric is for you, and then making sure that you have some benchmark and that you are keeping yourself accountable so that that can be improved over the year, is an important metric to be tracking. The last thing that is important for maybe a non-medicine-y metric to be tracking is mood. And it comes up all the time in the office. And of course, we're all familiar with things like depression and anxiety. But part of the human experience is that mood fluctuates. And sometimes the question for us is it normal fluctuation or is it abnormal fluctuation? And I think if you're taking inventory of how you're feeling and you're recognizing changes in your mood, it's a great opportunity to come and talk to your doctor about what that looks like and how we can be supportive. I hope you found these helpful. Thanks for watching, and I hope to see you in the next video.